Welcome back, y'all. Hope you're enjoying the sociological journey thus far. Today we're going to be talking about health and medicine. Health being the state of physical, mental, and social well-being. We're going to start with social epidemiology. This examines societal factors that affect the distribution of disease within certain populations, or it also, brings up the question, like, why do some countries do better than others in terms of overall health? Healthcare being the prevention of illness and disease. Sometimes that can be lacking in other places. I also want to touch on disability. This being any physical or mental impairment that limits a person's ability to perform their basic life activities. That's important to mention because 1/3 of Americans have some form of disability. So I also want to say that it's important to look at determinants of health and illness. An example of this could be our environmental conditions, because early life exposure to things like pollution has been linked and related to things like autism, schizophrenia, learning disabilities. Chemicals that are found in foods can cause irreversible developmental problems. Also chemicals found even in our water. Think like Flint, Michigan, and the thousands of children that apparently are suffering from different forms of disabilities because of the contaminated water they were consuming. Another determinant factor of health is demographic factors. We have to look at people's age, mainly because the death rate increases at age 45 and it escalates exponentially at 78 years old. Also, a lot of people past the age of 65 suffer due to chronic illnesses. These are like lifelong illnesses that develop gradually or are present at birth, as they sometimes are. Another example would be gender. Girls are more likely to experience Females, I should say, are more likely to experience depression as well as physical and sexual abuse, where on the other hand, men drive more, they take more risks, they work in riskier job fields, they won't see a doctor as often. Another example would be social class. The wealthiest Americans live 10 to 15 years longer than the poorest Americans, which is pretty incredible. Things like food deserts contribute to that. Lower classes have more dangerous jobs, at least they tend to. Another example of a determinant of health would be race and ethnicity, because minorities have lower infant mortality rates. Things like that are worse among minorities. They're more likely to die from heart disease, from high blood pressure, from diabetes. Another example of these determinants of health would be just lifestyle factors like smoking, overeating, which leads to obesity. Probably the last one I'll mention would be substance abuse, which we know what that is. We can talk about excessive alcohol or things like opiates or other dangerous drugs that affect people's health. Now, to get into the other part of our chapter, we're going to look at the social institution of medicine. Medicine deals with illness, injury, other health problems. 67% of Americans have insurance through employers, through unions. Taxpayers cover the rest of it. We spend more on healthcare than any other country in the world. That's an interesting thing that we will take a look at. We outspend more than 34 other high-income countries, and we actually rank 11th in terms of quality of care, access, efficiency, healthy outcomes. Other countries pay more in taxes, but they pay a lot less in healthcare. Now, to take a really brief look at all these sociological theories that you've grown to love, functionalists would say that health and medicine are critical in ensuring our survival, that sick people are expected to seek help, and this feeds the economy, in this case the healthcare economy, as well as making people functional to serve other parts of the economy. As for a conflict theorist, they're going to look at inequities in the healthcare system and inequities in general. They would also look at the fact that a lot of people get really rich from the healthcare industry, and that profit sometimes ignores people's needs when we're looking at things like insurance prices and access to insurance and things like that. From a feminist perspective, a feminist would say that men tend to control women's health, and that can be for a variety of reasons that we won't get into at this moment, but in the near future we will. We could also look at the fact that women tend to earn less than men in hospital settings and things of that nature. To look at it from a symbolic interactionist view, now we're looking at like the labeling of people as ill and how this increases them being stigmatized. I think when people start to get sick as they get old, they seem unemployable. So now we're taking a micro look at people and seeing what being sick or needing health care does to somebody's reputation. They see that the symbolic interactionist also sees medicalization as profitable. So think of the last like 10 to 20 years, how we've medicalized mental illness. That's not to say mental illness isn't an issue, but it's also not to say that people aren't getting rich from it. There's a whole industry out there to to make money from people suffering from things like depression, anxiety. There's a whole economy built around it that we just didn't have 10, 20, 30 years ago. So now that you've learned a little bit about health and medicine and learning how to apply these theories, we're going to move on and take a look at urban areas, urbanization, health, environment, that sort of thing. So we'll see you next time.